The explosion that killed Maria's entire medical unit left her as the only trained medic for 50 critically wounded soldiers in active combat zone. No backup, no evacuation, no hope, except for one determined woman who refused to let her brothers in arms die. For 12 grueling hours, Maria Santos would become the angel of death's greatest enemy, fighting not with weapons, but with bandages, courage, and an unbreakable will to save every life she could. In the mountainous region of Afghanistan's Helmand province, Bravo Company was conducting what intelligence had classified as a routine patrol mission when everything went catastrophically wrong. The improvised explosive device detonated beneath their lead vehicle with devastating precision, transforming a standard convoy movement into a nightmare scenario that would test the limits of human endurance and medical capability. Staff Sergeant Maria Santos felt her world explode into chaos as the IED's massive blast waved through her 20 feet from the medical transport vehicle. When she regained consciousness, her ears were ringing with a high-pitched whine that seemed to come from inside her skull, and the acrid smell of burning metal and something far worse filled her nostrils. As Maria struggled to her feet, wiping blood from a cut above her left eye, the scope of the disaster became horrifyingly clear. 50 soldiers from Bravo Company lay scattered across a 100-meter area, their bodies twisted in positions that spoke of tremendous violence. Some were screaming, others lay ominously still, and a few were trying to crawl toward whatever cover they could find. The medical team that had been her professional family for the past 18 months was gone. Dr. Richardson, the unit's primary physician, existed now only as scattered remains that Maria's mind refused to fully process. Nurse Williams lay motionless beneath a piece of twisted metal, her neck bent at an angle that made checking for vital signs unnecessary. The other medics, Martinez and Johnson, were critically wounded themselves, bleeding and unconscious, unable to provide the assistance that this catastrophic situation desperately required. Maria's medical bag had been damaged in the explosion, but most of its contents remained intact and usable. She quickly inventoried her supplies with the methodical precision that years of training had drilled into her: morphine ampoules, surgical bandages, intravenous fluid bags, antibiotics, surgical instruments, and various emergency medications. Enough to treat perhaps a dozen soldiers under normal circumstances. 50 men required treatment, at least 12 of them in immediately life-threatening condition. The mathematics of triage had never been more brutally clear. Maria implemented triage protocols with mechanical efficiency, moving from casualty to casualty while assessing wounds, checking vital signs, and establishing priority treatment orders. In medical school, triage had been theoretical exercises with mannequins and simulated injuries. Here, every decision carried the weight of a human life, and every choice meant that some soldiers would receive treatment while others would have to wait. Private Jackson, 19 years old and barely 6 months into his first deployment, had suffered massive trauma to his left leg. Arterial bleeding was painting the ground around him in expanding pools of crimson. Sergeant Miller, 34 years old and the father of 3 children, had taken shrapnel fragments to his chest cavity, and each labored breath produced pink foam that indicated punctured lungs. Corporal Davis, Maria's closest friend in the unit and the soldier who had taught her to play poker during long desert nights, was experiencing internal bleeding that made his abdomen rigid and distended. Each wounded soldier represented not just a medical case, but a person with family, dreams, and a future that now depended entirely on Maria's skills and the resources she could stretch across this field of carnage. Santos. Commander Peterson's voice cut through the chaos, even though he was dealing with his own injuries, a dislocated shoulder and what appeared to be a mild concussion. "What's our medical situation?" Maria had to tell him the truth, even though the words felt like admissions of failure. "Sir, the medical team is completely gone. I'm the only trained medic operational. We have 50 casualties, with 12 in critical condition requiring immediate surgical intervention. When can we expect backup medical support?" "Minimum 12 hours, sir. Weather conditions are preventing medevac flights, and ground transport through hostile territory isn't feasible until we can establish a secure corridor." Commander Peterson's expression revealed the gravity of their situation without him needing to voice it. 12 hours was an eternity when dealing with trauma cases. Many of the wounded soldiers wouldn't survive that long without intervention that exceeded the capabilities of a single field medic working with limited supplies. As Maria began her first round of medical interventions, Taliban forces initiated coordinated attacks on their position. The enemy had clearly observed the explosion and its aftermath, recognizing that wounded American soldiers represented both a tactical opportunity and a propaganda victory if they could prevent successful medical treatment and evacuation. Maria was applying a pressure bandage to Private Jackson's arterial bleeding when bullets began snapping through the air inches above her head. The Geneva Convention specifically prohibited targeting medical personnel, but the Taliban fighters showed no interest in following international warfare protocols. "Santos, get down!" Sergeant Rodriguez shouted from a defensive position behind an overturned vehicle. Rodriguez was one of only 8 soldiers who remained combat effective, and he was desperately trying to establish a defensive perimeter around the casualty collection point. "Can't," Maria replied, continuing to work on Jackson's 4-line even as rounds impacted the ground around them. "These men are my responsibility, and they need immediate medical attention." Rodriguez and the other uninjured soldiers attempted to provide covering fire while simultaneously establishing defensive positions. Their ammunition supply was limited, enemy numbers were unknown, and their primary mission had shifted from combat operations to protecting wounded comrades and their lone medical provider. During the first 2 hours, Maria operated on pure adrenaline and professional training, moving from casualty to casualty with focused determination. She concentrated on stabilizing the most critical cases, but every successful intervention consumed precious medical supplies that couldn't be replaced. Her morphine supply was disappearing rapidly. Maria made the agonizing decision to reserve pain medication only for soldiers experiencing the most severe trauma, knowing that others would have to endure significant pain while she dealt with more immediately life-threatening injuries. When her supply of sterile bandages was exhausted, Maria began tearing strips from her own uniform, sterilizing the fabric with alcohol and creating improvised wound dressings. Every piece of equipment had to serve multiple purposes, and every decision required balancing immediate needs against future requirements that she couldn't accurately predict. Sergeant Williams began losing consciousness due to internal bleeding, prompting Maria to establish an intravenous line and attempt to replace his lost blood volume with 4 fluids. However, without access to blood bank supplies, she realized she would need to attempt direct blood transfusions between soldiers with compatible blood types. "Who knows their blood type?" she called out to the conscious wounded. "I need type O positive donors immediately." 3 soldiers raised their hands despite their own injuries. Maria quickly performed blood draws from the healthiest of the volunteers and began a primitive field transfusion for Williams. The infection risk was enormous under these unsanitary conditions, but the risk of death from blood loss was far more immediate and certain. During the 4th hour, Maria suffered her first loss. Private Morrison, 20 years old and engaged to his high school sweetheart, succumbed to massive blood loss despite every intervention Maria could attempt. She performed CPR, administered adrenaline injections, tried every emergency protocol in her training, but his injuries were simply too severe for field treatment. As Maria closed Morrison's eyes and removed his dog tags for later notification of his family, her hands trembled with exhaustion and emotional strain. This was her first Kia, killed in action, as the sole medical officer, and it felt like a personal failure even though she intellectually understood that some wounds exceed the capability of any medical intervention. "Santos," said Corporal Davis, despite his own critical injuries, "this isn't your fault. You're doing everything humanly possible under impossible circumstances. It's not enough, Davis. I need to be better, faster, more effective." But how could she improve performance that was already pushing beyond normal human limits? How could one person, working alone with limited resources under enemy fire, successfully treat 49 critically wounded soldiers over a 12-hour period? The weight of individual responsibility for so many lives was psychologically crushing. Every decision carried life or death consequences, and every mistake would result in a funeral that she would have to attend, a family that she would have to face, and guilt that she would carry for the rest of her life. During the 5th hour, Maria made one of the most difficult decisions of her medical career. Instead of attempting to provide equal treatment to all casualties, she would implement strict triage protocols that prioritized soldiers with the highest probability of survival. This meant making conscious choices to provide comfort care rather than aggressive treatment to soldiers whose injuries exceeded the realistic capabilities of field medicine. This decision violated every instinct Maria had developed during her medical training, but it was a practical necessity demanded by their situation. Resources were finite, time was limited, and attempting to save everyone might result in losing everyone. The emotional cost of this decision was devastating. Sergeant Thompson, a 15-year veteran with 3 Purple Hearts, had sustained massive head trauma that would require neurosurgical intervention to have any chance of survival. His consciousness was intermittent, but during lucid moments, he was aware enough to understand his situation. "Doc," Thompson said during one of his coherent periods, "I know I'm not going to make it home this time." Maria struggled to maintain professional composure while her heart was breaking. "You're a fighter, Thompson. Don't give up on me now. Listen, Doc, I need you to tell my family something. Tell them I love them, and tell them I wasn't afraid at the end." Maria administered the last of her morphine to Thompson, knowing that she could make his final hours comfortable but couldn't save his life. This allocation meant that other wounded soldiers would have to endure pain without pharmaceutical relief, but Thompson's suffering was immediate and his time was limited. During the 6th hour, sunset brought both advantages and new challenges. Enemy sniper fire decreased significantly in the darkness, allowing Maria to move more freely between casualties without exposing herself to constant threats. However, working conditions became considerably more difficult as visibility dropped to nearly zero. Maria activated emergency lanterns and flashlights to continue her medical work, knowing that these lights would create target indicators for enemy forces but understanding that medical treatment was impossible in complete darkness. Every illuminated moment represented a calculated risk between enemy detection and patient care requirements. The psychological impact of darkness was profound for both Maria and her patients. Wounded soldiers who had been maintaining morale during daylight began experiencing panic reactions as night deepened around them. The combination of pain, blood loss, and sensory isolation created conditions that challenged mental stability along with physical survival. During the middle of the night, something unexpected happened that provided Maria with desperately needed hope. Corporal Williams, who had received her improvised blood transfusion hours earlier, regained consciousness and demonstrated significantly improved vital signs. "Santos, you brought me back," Williams whispered. "Don't celebrate yet, Williams. Keep fighting. Your family is waiting for you to come home." This small victory provided Maria with emotional strength to continue her seemingly impossible mission. If she could save Williams under these conditions, perhaps other soldiers could be saved as well. Perhaps this nightmare scenario wouldn't end in complete tragedy. Shortly after midnight, Maria encountered her greatest medical challenge of the entire ordeal. Private Anderson, 22 years old and a former pre-med student, was experiencing severe abdominal trauma with obvious internal bleeding that required immediate surgical intervention. Without access to an operating room, proper surgical equipment, or anesthesia, Maria realized she would have to attempt field surgery under conditions that would challenge experienced surgeons in fully equipped hospitals. Maria made the decision to perform emergency abdominal surgery using her field medical kit and improvised instruments. She sterilized her equipment with alcohol, created the best sterile field possible under battlefield conditions, and prepared to open Anderson's abdomen using only a flashlight for illumination and her basic surgical training for guidance. This was Maria's first attempt at field surgery beyond basic wound repair and suturing. Her medical school training had included theoretical surgical education, but performing surgery under combat conditions with inadequate equipment was completely different from classroom learning and hospital rotations. The 40-minute surgical procedure tested every aspect of Maria's medical knowledge and manual dexterity. Working by flashlight with improvised instruments, she located the source of Anderson's internal bleeding, repaired damaged blood vessels, and closed multiple puncture wounds in his intestinal tract. Her hands never trembled despite the enormous pressure, because Anderson's life depended entirely on her steady performance. The surgery was successful. Anderson's internal bleeding stopped, his vital signs stabilized, and his chances of survival improved dramatically. This medical victory provided Maria with confidence that she could handle even the most challenging cases if she remained focused and utilized her training effectively. During the 9th hour, Taliban forces launched their most coordinated and aggressive attack of the night. Multiple enemy positions initiated simultaneous fire on the American position, creating a crossfire that endangered everyone in the casualty collection area. Maria found herself protecting medical supplies and wounded soldiers simultaneously, moving critical patients to more protected positions while continuing to provide medical treatment under direct enemy fire. The physical demands of moving wounded soldiers while maintaining her own safety pushed her to the limits of endurance. Sergeant Rodriguez, who had been maintaining defensive fire throughout the night, shouted a warning that chilled Maria's blood. "Santos. We're critically low on ammunition. You need to prepare for possible evacuation." "I can't move them, Rodriguez. Too many critical cases won't survive transport." "Then we make our stand here together." Maria faced an impossible tactical decision. Remaining in position meant risking annihilation by superior enemy forces, but attempting to move critically wounded soldiers could kill patients who might otherwise survive until evacuation arrived. She developed a compromise solution, moving the most critical patients to a partially protected cave formation while maintaining defensive positions for soldiers who could be moved safely. This required multiple trips through enemy fire, carrying wounded soldiers and medical equipment while Taliban fighters attempted to prevent American casualties from receiving treatment. Near dawn, an unexpected development changed everything. Charlie Company, conducting a separate patrol mission in the area, heard the sounds of sustained combat and decided to investigate the source of the fighting. "This is Sergeant Jackson, Charlie Company. Identify yourselves and state your situation." Maria responded immediately on the tactical radio frequency. "This is Staff Sergeant Santos, Bravo Company medic. I have 47 wounded soldiers requiring immediate medical evacuation." "Santos? We received reports that Bravo Company was completely destroyed." "Negative. We're still operational and still fighting." The arrival of Charlie Company fundamentally changed their tactical situation. The reinforcements brought additional ammunition, fresh medical supplies, and most importantly, the additional firepower needed to secure their position against enemy attack. Charlie Company's medic, Corporal Stevens, assessed Maria's work with professional amazement. 12 wounded soldiers had been stabilized in conditions that would challenge a fully equipped medical team, and 47 soldiers remained alive despite catastrophic initial casualties and sustained enemy contact. When reinforcements arrived, Maria had been working continuously for 11 hours without rest, food, or water. Physical exhaustion, dehydration, and emotional stress were affecting her performance, but the end of her solitary medical mission was finally approaching. Corporal Stevens, Charlie Company's medic, surveyed Maria's medical work with professional disbelief. "Santos, how did you manage to keep 47 men alive for 11 hours under these conditions?" "I didn't keep them all alive, Stevens. I lost 3 soldiers." "Maria, you performed medical miracles here. Most medics couldn't have saved half this many under normal hospital conditions." Maria struggled to accept this praise because her focus remained on the soldiers she had been unable to save. 3 families would receive death notifications, 3 funerals would occur, and 3 sets of personal effects would be shipped home because she hadn't been skilled enough, fast enough, or resourceful enough to prevent their deaths. At first light, weather conditions finally cleared sufficiently to allow medical evacuation helicopters to reach their position. Maria coordinated patient prioritization for evacuation, ensuring that the most critically wounded soldiers received priority boarding on the first available aircraft. She performed final medical assessments on each casualty as they were loaded onto evacuation helicopters, providing medical personnel with complete status reports and treatment histories for every patient. Even in her exhausted condition, Maria maintained professional standards and attention to detail that would assist hospital medical teams in providing optimal care. Private Anderson, the soldier who had undergone field surgery, gripped Maria's hand as he was loaded onto the helicopter. "Doc, you saved my life. I owe you everything." "You don't owe me anything, Anderson. Just get better and go home to your family." Sergeant Williams, who had received the emergency blood transfusion, expressed his gratitude with tears in his eyes. "Santos, you're an angel of mercy. I'm going to tell my family everything about what you did here." As the helicopters departed with their human cargo, Maria felt the weight of 12 hours settling onto her shoulders like a physical burden. She had given everything she possessed, medically, physically, and emotionally, to keep her fellow soldiers alive. When the last helicopter lifted Maria from the battlefield, she had worked for 12 continuous hours without breaks for food, water, or rest. She was severely dehydrated, physically exhausted, and emotionally devastated, but she had completed her mission under conditions that exceeded normal human endurance. During the flight to the military hospital, Maria received the overall casualty report: 50 wounded soldiers from the original IED attack, 47 successfully evacuated alive. A 94% survival rate under impossible conditions represented an extraordinary medical achievement that would be studied and discussed in military medical training for decades. However, Maria's thoughts focused entirely on the 3 soldiers she had been unable to save: Morrison, Thompson, and Garcia. Their faces would remain in her memory forever, and their deaths would challenge her confidence and professional self-worth despite the objective success of her medical performance. At the military hospital in Germany, Maria slept for 3 consecutive days while receiving intravenous treatment for dehydration and exhaustion. Her body required time to recover from the physical demands of 12 hours of continuous medical work under combat conditions. When she awakened, her hospital room was filled with cards, letters, and flowers from the soldiers she had saved. Each wounded soldier had sent personal messages expressing gratitude for her medical care and acknowledging that their survival was directly attributable to her skills and determination. Anderson's letter was particularly emotional and medically significant. "Dear Doc Santos, the surgeons here told me that the field surgery you performed saved my life. They couldn't believe that emergency surgery of that complexity and precision could be performed under combat conditions with improvised equipment. You're not just a medic, you're a miracle worker. My wife and unborn child owe you their future happiness." Williams wrote about the psychological impact of her care. "Santos, when I was bleeding out and thought I was going to die, you gave me hope. Not just medical treatment, but human compassion that made me believe I could survive. You didn't just save my body, you saved my spirit." 1 week after her hospitalization, Maria received a visit from Colonel Matthews, who brought official commendation and recognition for her actions during the 12-hour medical crisis. "Staff Sergeant Santos," the colonel announced formally, "your actions during the Bravo Company incident represent the finest traditions of military medical service and personal courage under fire. You are being recommended for the Silver Star for gallantry in action. Sir, with respect, I don't deserve any medal. I lost 3 soldiers under my care. Santos, you saved 47 lives under conditions that would have overwhelmed most medical teams. Those 3 soldiers died from combat injuries, not from medical failure. You gave them every possible fighting chance, and that represents the highest standard of military medicine." Maria struggled to accept this perspective because survivors' guilt dominated her emotional response to the entire experience. The soldiers who died seemed more significant than the soldiers who lived, despite objective evidence that her performance had been extraordinary. During her hospital recovery, Maria repeatedly analyzed every decision she had made during those 12 hours. Could she have worked faster? Could she have made better medical decisions? Could she have saved Thompson, Morrison, and Garcia if she had been more skilled or better prepared? Eventually, Maria reached an understanding that would shape the rest of her military career. She had performed at the maximum level of her capabilities under conditions that exceeded normal human endurance. The outcome wasn't perfect, but it represented the best possible result given the resources and circumstances she had faced. The 47 soldiers who survived would return to their families, continue their lives, and contribute to society because she had refused to give up when the situation appeared hopeless. This represented the true measure of her accomplishment. Regardless of the soldiers she had been unable to save. After her recovery, Maria was offered several assignment options, including a safe rear-area hospital position that would remove her from combat operations. However, she chose to continue serving as a field medic. "Why would you make that choice?" Colonel Matthews asked. "After what you experienced, wouldn't you prefer a safer assignment?" "Because soldiers in combat zones need medical care, sir. And I know that I can make a difference when it matters most." "Even after the trauma you experienced during that 12-hour period?" "Especially because of what I experienced. Now I understand what I'm capable of accomplishing when soldiers' lives depend on my skills and determination." Maria's decision reflected her understanding that her experience, while traumatic, had proven her capabilities under the most extreme conditions imaginable. She had learned that she could function effectively when everything depended on her performance, and that knowledge made her more valuable as a combat medic. Before her final deployment to Afghanistan, Maria visited several of the soldiers she had saved during that 12-hour ordeal. They had returned to the United States, reunited with their families, and resumed normal civilian lives that would have been impossible without her medical intervention. She attended Anderson's wedding and held his newborn daughter, understanding that this child existed because of decisions she had made on a battlefield 12 months earlier. Williams invited her to a ceremony where he renewed his wedding vows with his wife, celebrating life and love that had nearly been lost. Davis had enrolled in college using his military education benefits, pursuing studies that would have been impossible if he had died from internal bleeding in Afghanistan. Each of these soldiers told Maria how that 12-hour period had changed their perspective on life, family, and the importance of human compassion during crisis situations. They described her not just as a medical professional, but as someone who had demonstrated that individual human beings possess the capacity for extraordinary performance when others depend on their skills and determination. Maria eventually understood that true heroism doesn't require perfect outcomes or flawless performance. Instead, heroism consists of ordinary people accomplishing extraordinary things when circumstances demand maximum effort and personal sacrifice. During those 12 hours, she hadn't just applied her medical training, she had demonstrated humanity, determination, and unbreakable commitment to preserving life regardless of personal cost. The soldiers she saved understood this, their families understood this, and eventually Maria understood this as well. Her story became part of military medical training curricula, not because her performance was perfect, but because it demonstrated what dedicated medical professionals could accomplish when they refused to accept defeat even under seemingly impossible conditions. The 3 soldiers she had been unable to save died knowing that someone cared enough to risk everything attempting to preserve their lives. The 47 soldiers she saved lived because she had refused to abandon them when abandonment would have been understandable and forgivable. Years later, when Maria transitioned from active duty to civilian medical practice, she carried lessons from that 12-hour period into every patient interaction. She understood that medical care represents more than technical skills, it requires compassion, determination, and willingness to give everything you possess when human life depends on your performance. The soldiers she saved went on to live complete lives, raise families, build careers, and contribute to their communities in ways that multiplied the impact of her medical intervention. Children were born who would not have existed, marriages occurred that would have been prevented by death, and countless small moments of human happiness occurred because one person refused to give up when giving up would have been reasonable. Maria's 12 hours of hell became a testament to the power of individual determination, professional competence, and human compassion to overcome seemingly impossible circumstances. Her story proved that sometimes the most important battles are fought not with weapons, but with medical instruments, determination, and an unbreakable commitment to preserving human life, and that's Maria Santos' 12 hours of hell, the medic who saved 47 lives under impossible conditions. Here at Last Signal Stories, we believe every soldier's final message deserves to be heard. If this story of courage, compassion, and unbreakable determination moved you, hit subscribe for more military stories. Drop a comment below. what would you have done in Maria's situation? Until next time, stay tuned for the signal.